to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And as you know, we've been focusing on the health of the Nigerian, the health of the black person by extension, but the health of the Nigerian. As we know, there are several issues that concern us as Nigerians, especially cardiovascular disorders, brain issues, diabetes, sickle cell disease, and a few others. And a lot of credit to the government, the Ministry of Health, and other organizations, and the NTA and other organizations, and we're trying to raise awareness and bring these issues to light, especially when it comes to you, the individual. You need to know what to do to take control of your health, and you need to know what to avoid so that you don't fall into many of the health pitfalls that many people fall into these days. So today we have a very special guest and a very special topic, and I think it's gaining importance as we go along, and that topic is patient safety. And with me on the platform, with me on this on the stage, is a very dear friend of whom I've known for a long time, but who is extremely passionate about patient safety and healthcare in Nigeria as a whole. And her name is pharmacist Estelle Mbadiwe. Did I get that right?
Yes, you did.
Thank you so much for joining us on the show today.
Thank you very much for inviting me.
And she is, let me get this, I'm sure I got this right. I hope I get this right. Dusit Blue Solutions.
Yes.
Awesome. What is that about?
So Dusit Blue Solutions is a healthcare consultancy company, and our focus is on improving the quality of healthcare, providing solutions and strategies to improve patient safety and improve quality of healthcare. So we do that by working with both the government and facilities directly.
Facilities as in hospitals?
Hospitals, health.
Okay.
Yes.
Okay.
Yes.
And so the government, so you act like as a consultant with the government to emphasize these issues that you're concerned about. And I'm assuming that you're bringing in a lot of these principles and these practices from your experience as a pharmacist in the UK.
Yes, my experience as a pharmacist and also my experience in health policy, planning and financing, and as a consultant working on change management and behavioral change to try and institutionalize some of these solutions. So we're trying to bring global best practice and localize it, obviously, for the unique environment in Nigeria. So it's not just a copy and paste, it's localizing the solution so that it fits with the need of the Nigerian environment and the Nigerian patients.
That's a tall order.
Yes.
Yeah, I'm sure you have your work cut out for you.
Yes. We collaborate with a lot of people, and it's really important to work with what is in the system, what is in place, to embed this into what's in place to improve the chances of getting a successful outcome.
Got it. Patient safety, what's that about? Why should we care?
Why should we care? So patient safety, we should all care because healthcare is something that you can pick and choose when you need it. Obviously, like you mentioned earlier, there's a lot of chronic conditions, cardiovascular conditions, which are more long-term, but also there are also emergency need for healthcare. So if we don't care about improving the safety of the healthcare that we deliver, like I said, you can't pick and choose. So if we don't institutionalize patient safety, the outcomes will be very poor. We already have quite poor health indices in the country. So we need to make sure that the care that we're delivering to the patient is safe and of as good quality as is possible.
And I agree with you. I think you and I were talking about some of the issues that have come up in the past. And in my case, because we deal with children in our foundation, and we've had instances in which, I'm not going to mention names, but in one of the hospitals in Nigeria, in Abuja here, a child with diabetes, what you call it, type 1 diabetes, insulin dependent. So the parents took her to the hospital. She was supposed to have a certain level, I think it was a small percentage of insulin that was supposed to be injected to her on a daily basis. And the nurse at that time, and this is what the parents said, the nurse told them instead of 0.3%, they said they gave up to 30%. 30 mils. 30
milligrams.
And of course, That's 100%, 100 times, not 100%, 100 times what the child was supposed to have, and instantly, as you can imagine what happened. Instantly went into seizures, coma, and was paralyzed. And in fact, when they brought her into the center, our center, she was completely hard, flat-boarded. In fact, not just flat-boarded, but she was hyperextended. In other words, the back of her head was almost touching was going towards touching the back of her feet. And the nurses, well, there was really nothing that came out of it. The parents, they investigated, trying to get them to justice, get the people involved to justice. But basically they were advised that it's a dead end. They're not going to get anything done out of this. And so here's the woman stuck with the only child she has. She's stuck with looking for health care for this child, and it's 24 hours of care for that, basically on a medical error. So is that kind of like what we're looking at? I mean, avoiding things like that. Is that kind of like what you're trying to institute and institutionalize? Yeah,
the reality, unfortunately, cases like this, negligence cases are common. The reality is that healthcare, to err is human, so errors will happen in the healthcare sector, but fundamentally is how it's handled, how it's managed. Do they have a system where they're doing root cause analysis to identify what happened, to make sure that they try and put steps in place and systems in place to mitigate it happening again?
Do hospitals are they doing that really at this point?
This is exactly what we're trying to say. We need to build in a system of accountability. There's this concept of clinical governance where the organization has to be accountable for the care that it delivers. So if something like this happens, it shouldn't be a case that the parents are now left feeling like they have no hope, they have nowhere to turn. And, so there should be a system in place where we know that the parents have an option to investigate it, because otherwise it will just keep happening. And unfortunately, this is what happens in a lot of facilities. So the CPC, the Consumer Protection Council, with the Ministry of Health, last year they launched the Patient Bill of Rights.
Patient Bill of Rights.
Patient Bill of Rights, exactly. So this is really to try and give patients, to inform patients that they have a right to quality care. And there are 12 points in that when they did the launch. There are 12 specific points looking at things like patients' right to complain, patients' right to a clean, safe environment, patients' right to understanding the outcomes, because sometimes when these things happen, they don't even know what's happening. So ultimately, we want to empower the patient to know what their rights are. So when they're in this situation, they're not left stranded. They know that you can contact the CPC and some other agencies to find out what you can do. Fantastic. To protect yourself and your family.
Fantastic. And that's, I love that part, empowering the patients, because that's really what we're all about, empowering you with the knowledge you need to seek your rights and to enforce your rights. We'll be right back in a few minutes. Stay tuned. Okay, so we are back, and we are on Your Health in Your Hands, and we're speaking about patient safety with pharmacist Estelle Mbadiwe. I have to say, it's really hard for me to call you that, because of course, we have a name that I call you, but we will not say that on live television. Thank you again for having us on the show, pharmacist Estelle. All right, so in the last segment, we were talking about, importance of consumer protection, and then the 12, what do you call them again?
The Patient's Bill of Rights.
Patient's Bill of Rights. But let's be frank. How much of that really is going to be actually applied or applicable? Somebody in Kura, for instance, one village off somewhere, he may be able to stumble upon this across this on TV and say, well, that's all well and good, but
what's the reality?
What is the reality? How does this translate?
So the reality is this. So I had a conversation with the DG of the CPC, because in Nigeria we have a lot of great policies. We have a lot of great guidelines and policies, but its implementation is normally the bottleneck. So my focus was, how is this bill going to be, how is it going to be implemented, and how is it going to be enforced, that something needs to be done. So I know the DG of the CPC is...
CPC is what?
The Consumer Protection Council.
Okay.
So they're the people that launched the Patient's Bill of Rights with the Ministry of Health.
Okay.
So he's very passionate, and he's trying to put systems in place to create a system of enforcing this.
Okay.
And the reality is that currently a lot of patients, things happen and people go on social media. Maybe there was an incident with a family member, people put it on social media, and it's growing because of the social awareness of this issue. People are becoming more aware, and doing things like this, we're empowering people, creating more awareness. There was a recent case in a hospital here in Abuja where some relatives went with a lady who needed to seek healthcare. Ultimately, the long and short of it is that they felt she wasn't attended to or wasn't attended to appropriately or fast enough, and the lady ended up dying.
Okay.
So they actually went back to the hospital and protested outside the hospital, and they basically insisted and demanded that the CMD of the hospital, someone comes to address them, which he did, and the CMD came out, addressed the relatives and the people, the friends, the well-wishers, to say that he's going to make sure that an investigation is done and something is done about this case. So we need to empower people to know that not only is this patient bill of rights out there, but you can actually do something. You have a right to ask questions. It's not okay for the hospital to tell you just that's how it is and drive out.
Yeah, but what if they go and ask questions and they try to see the CMD or whatever and the doors are shut in their face?
Yeah.
Is there any other recourse? Is there any other way to so that hospitals can know in the future that they can't get away with such things?
Yes, like you made a very valid point about facilities knowing that patients will come and start asking questions.
They can be held accountable.
They can be held accountable because my passion piece is around building systems, around ensuring there's accountability in our health sector. Because I think without accountability, this is across the board, even down to the budgetary allocation for health, which there's meant to be a budget declaration of 15%, but of course we know we're hovering around 4% generally.
In actuality,
there should be 15%.
Of our budget is being spent on.
Plus or minus, it swings around that figure. So the reality is that there needs to be more accountability for improving and budgeting for health appropriately. And, in our organization, we work with organizations and facilities to try and build in change management because it's not easy to move from where they are from the status quo to where we want them to be. So we want to empower the organization with the right skill sets and also do training. So organizations need to do continuous development of their staff, continuous quality improvement strategies need to be built into the systems at the organizational level.
And can this, you think, be signed into law? Because I agree with you, and we were talking about this just before we started the show, is that when new staff come into a hospital, nurses, lab technicians, doctors, physiotherapists, shouldn't there be like a kind of like entry training to say about hospital safety and the fact that you can't just get away with stuff anymore, and that you have to treat your patients with respect and listen to their concerns and all that. That's as you and I rightly you said that the hospital without the patients, the hospital does not exist, right? Because
patient is king. Yes,
patient is king, exactly. So, do you know if some hospitals? I know not about all hospitals, but are some hospitals actually trying to put that into practice, training of those things, or are you trying to train? Have you got into any hospitals to kind of train, offer to train their staff on these things? Yeah.
So basically, the hospitals they definitely have some training that they do an induction for the staff, but with healthcare, it needs to be dynamic. You need to review: is it appropriate for global best practice to ensure that you're delivering the best care to your patient. So this is something that needs to be reviewed currently with what is happening globally. The world is moving very fast, and we need to make sure that Nigeria and the health facilities in Nigeria are moving in that pace, because we lose approximately $1 billion annually to health tourism.
Who?
Nigeria.
Nigeria?
Yes. $1 billion approximately to health tourism. So this is money that is lost that could obviously be invested back into our health sector.
Wow.
We lose not just patients going for medical tourism. We're obviously having a huge amount of brain drain with doctors, etc., healthcare professionals leaving the country. So if we think of how much people are willing to spend $1 billion annually, approximately, we need to build the trust in the system. This is most of the time is lack of trust in the system that leads to people, leaving to get sometimes the most basic healthcare.
I think you've touched on a very important point there. This lack of trust thing. But seriously, we're going to jump into that thoughts, because is it just about patient safety? Are there other issues where we need to be concerned about? But let's hold that thought for now, and then we'll get back into that in a few minutes. So stay tuned, folks. Welcome back. So we are talking about patient safety, and our last thought was about trust and accountability and how that affects, what do you call it again, medical tourism?
Yeah.
We can talk.
Yeah.
And a staggering figure,
1 billion.
$1 billion are being spent by Nigerians, not the Nigerian government now.
Nigerians as
a whole.
I don't know the classification.
So when they go to South Africa, to India, to Pakistan, to Germany, and all these other places where quote unquote medical care is superior, well,
it's perceived.
It's perceived. Yes. That's the word, perceived, because we have really well-trained doctors. I mean, I know that my colleagues in the U.S. Many a time they're at the top level. They're the chief residents during their training. They enter. They get really good positions in top-ranked hospitals. So there's nothing. I would say that our training is certainly above average.
Yes.
But what you're saying, or what you seem to be saying, is that it's beyond just training and expertise. It has to do with patients, the way patient safety is perceived by the patients in the hospital.
The public, yes.
Can you expand on that?
Yeah, so you mentioned, like you said, the doctors, the training. You know, the Nigerian government invests a huge amount of money in training of medical personnel. You know, I did my training in the UK, and I know the equivalent amount spent compared to how much is spent here is so much less here.
Yeah, it's pretty much cheap. It's pretty much
exactly.
I think during our time was it free of? I think it was free of charge. We just had to buy. I had to pay for accommodation and a few other things, but tuition was next to nothing. If I paid anything.
Exactly.
And I went to, well, some would argue the best medical school in Nigeria, but some would take offense at that. But let's keep going.
Yeah. So basically, the government is investing so much money in training doctors, which is why, and then they lose them. They lose them to other countries. You know, the amount of countries that come in, Saudi Arabia, the UK, US. Now the hotbed is now Australia.
Why, Canada is full now, because Canada used to be the cliche now. Everyone's
going to Canada, but now Australia seems to be the, you know. So the point is that we have the expertise. You know, I worked in the NHS system, and I worked with doctors. A lot of time, Nigerian doctors or Nigerian healthcare professionals were the best in the UK. Yes. Right. So sometimes they're the best. We recently had a doctor that, you know, I think it was in the US, that delivered the baby, operated on a baby
whilst in the womb.
Exactly, and then put the baby back, and then the mother carried. You know, that was a Nigerian doctor. So we have the expertise, but unfortunately, because of various things, again, I personally still put it down to accountability.
Okay.
In the system. So we don't have the equipment, we don't have the training. So the healthcare professionals here feel like they don't have the tools, so to speak, to deliver that best quality care. So the patients feel like they can't trust the system. They believe with all these issues of negligence and no one's accountable, they feel, you know, as we say in Nigeria, no one wants stories that touch, right? So they feel if they have the means, they will rather take that risk and travel out of the country to get care. So we're losing that amount of money, you know, each year to other clients.
So you think by ensuring or at least improving patient safety, we can stem the drain?
Yes. Improving patient safety, improving accountability. I always say this to when I meet commissioners of health from different states. I always tell them, why don't your state focus on health? As to be the health tourism capital of Nigeria. Instead of that money that's going out, focus on building the systems in your state, so your state becomes that health tourism capital. And the income that will be generated from healthcare will be quite significant. A lot of times the politicians, the policymakers don't understand the economics of healthcare.
Well, we're talking about long-term investment.
This is long-term investment,
and many times the politicians are just there for a few years. So it's hard to, I think it's a tall order convincing
tall.
them to do it a long time. But have
We
there
have to
been
start
any,
somewhere.
what have the responses been for when you talk to these commissioners about?
Well,
about
it's mixed because
thing?
I can't think of the state that is currently that I can say is
Yeah.
a health, because this is a perception. This has to be based on evidence.
Yeah.
So the facilities down to the individual hospitals have to be transparent with the quality of care they deliver. You know, when things go wrong, how they manage the errors that happen at their facility. This is all going to build trust in that facility and will drive the patients to come back to those facilities. So it's very important how, you know, the concept of accountability, the concept of safety at the facility level is addressed by the leadership.
But don't you think also the legal system, the Nigerian legal system too, has to be brought in? Because, and if I've heard this if I've heard this once, I've heard it 1,000 times.
Yes.
Okay, well, maybe not that many times, but they say that if there's a case of malpractice, they keep saying if you are trying to seek redress through the legal system, you're wasting your time. They will shut you down. They'll put roadblocks ahead. You end up spending a lot of money, and they just keep on postponing and postponing, and really nothing gets done.
Yeah.
So don't you think, in all this talk about CPC and the Ministry of Health and other places, don't you think that maybe that also needs to be addressed?
Yeah.
That the legal system, the Nigerian legal system too, has to be, you know, made aware that there has to be, I mean,
medical legal.
yes, the people should know that there's a recourse,
Yes.
and then there are penalties involved
Exactly.
with mishandling cases.
Yeah.
I'm not saying that you get carried away like the US, where they have the ambulance chasers. They say whatever problem you have, just tell us no, and we'll get your $1 million or $200 million and whatever it is. But we're talking about reasonable redress. Let doctors and hospitals know that you need to get this right, and you need to put all the safety checks in place to ensure that these patients, from the richest to the poorest, because we tend to say, oh, the poor don't matter. I'm not saying everybody says that, but we just don't tend to take it as seriously. I mean, everything from ensuring that this patient gets their test done quickly. If they're in a match accidents and emergency, for instance, they clean the floor, make sure the cleaners are there, so that if there's any vomit on the floor, for instance, it's cleaned up so that so that treatment can be given. I mean, something as simple as that. I've actually seen in one case where they stopped treatment because the cleaner was not available to clean up the vomit. And everybody just sat down and said, well, when the cleaner comes, we'll clean it up, and then we can give the injection, then we can take the blood samples. Can you imagine that?
So I think the key thing is about creating learning organizations, creating systems where it's not just focusing on just being purely punitive. You have to create learning organizations. So there's also incentives, and as well, like you said, consequences when things happen. And it's really to build and empower the multidisciplinary team. This is something that causes a lot of issues in this climb, with a lot of intra-professional rivalry, which means that we're forgetting the patient. You know, we need to focus on patient-centered care. So instead of fighting each other, we need to take it back to the patient-centered care and build those systems, empower the multidisciplinary team to know that this is the only way that things can work. So, you know, yesterday I was on a call with a patient safety call with some Kenyan colleagues, and they were saying, I think 54 million shillings or something was awarded to a patient recently. It was a groundbreaking case in Kenya for malpractice. So maybe we need some of those cases to come up to be able to,
I think that's a really good point. Pharmacist Estelle, I'm so sorry we've come to the end of this show. This is something that I think we need to keep on hammering and talking about a lot longer, and I hope you'll be able to find time to make it to this show again. Thank you so much again.
Thank you very much.
Well, folks, thanks for joining us. If you have any questions, be sure to check our platforms, our WhatsApp message, send the WhatsApp messages, YouTube, Facebook, you know, all the rest. Be sure to join us next week for these programs. And remember, your health is in your hands, and you make of it what you will. But it's very important that you take control of your health. God bless. See you next week.